second speaker of the session is Dr. Sudhir Pandeke, and the presenting author is Dr. Shashil Batra. Sahil Batra, and the topic is critical analysis of saprophysis shunt in MIGS in primary angle glaucoma, primary open angle glaucoma. Yeah. So go ahead, please.
Good morning to all dignitaries.
It's 5 minutes, please stick to the time.
Yes, sir. My topic for today is critical analysis of SALOPENSP shunt in MIGS in primary open angle glaucoma. So, the main purpose of this study was to show that microincision glaucoma surgery is one of the most recent surgical modality in treatment of glaucoma, and we have made SALOPENSP shunt, which is a further advancement in this modality. It is a cheaper alternative to other glaucoma implants, and it costs roughly 50 to 100 rupees, that is around $1 and it is very useful in the modern practice. SP shunt is very easy to operate, and the learning curve is very easy as compared to other glaucoma implants, and also it is made up of PMMA material, which has been in use for more than 50 years.
70 I have kept as the standard, and then above and below I'll go.
Yeah, the slides are not changing. The slides are not changing.
So the design of this study was, this was a hospital-based randomized prospective study which we have taken as a pilot project. It included 50 eyes of patients of primary angle open angle glaucoma who were willing to do microincision glaucoma surgery with SP shunt. The study site was in the ophthalmology department of a tertiary care hospital. Inclusion criteria included patients who are diagnosed cases of primary open angle glaucoma and were willing for shunt surgery, and exclusion criteria was all other forms of glaucoma, including normal tension glaucoma. Patients were assessed pre-operatively, history was taken, visual acuity, best corrected visual acuity, IOP measurement was done by applanation tonometry, gonioscopy was done, perimetry was done, and fundus examination was done. And post-operatively, patients were followed up at 1 day, 1 week, 1 month, 3 months, 6 months, and 1 year. And various post-operative complications were looked out for, especially fibrosis of failure of filtration. So what is SP shunt? So this is how it is made basically. This is a scleral fixated IOL on the right, on the left, and the distal 3 mm part of the haptic of the IOL is cut. So SP shunt is basically, it is a C-shaped implant made of PMMA, and the distal, and this implant then has the eyelet of the SF IOL, which is used to fix the implant in the scleral groove. Here the steps of the surgery are shown. We have made a superficial partial thickness scleral flap, and a scleral groove has been made. Here we have used a 22 gauge needle to make a passage of roughly 0.7 millimeters into the anterior chamber, and here we can see the SP shunt. The proximal 1 mm of the SP shunt is placed into the anterior chamber, and the distal 2 mm is placed in the scleral groove. And then it is sutured via the eyelet. It is sutured using a 10-0 polypropylene suture. 2 such implants are placed in one scleral groove, and then the scleral flap is closed and conjunctival flap is closed. So observations were, first we have seen, this is a table showing the distribution of the patients. The first group has 29 patients with a male preponderance. Second group has 18 patients with both male and females equal, and third group has 3 patients female. This is a table showing the preoperative and postoperative IOPs of the patients. In first group, we can see preoperatively the mean IOP was 28.62 plus minus 1.25 millimeters of mercury, and after 1 year it was 12.40 plus minus 1.40 millimeters of mercury. In the second group, it was the mean IOP preoperatively was 33.14 plus minus 2.25 millimeters of mercury, and after 1 year it was 16.12 millimeters of mercury. And in the third group, the mean preoperative IOP was 40.08 millimeters of mercury, and after 1 year it was around 18.05 millimeters of mercury. So the main complications, we didn't face any such anterior chamber complications. The main complication we found was failure of filtration. In the first group, 1 patient had failure of filtration. In the second group, 3 patients had failure of filtration, and in the third group, 3 patients had failure of filtration. So total of 7 patients had failure of filtration out of the 50 patients. So all in all, in conclusion, we can say that microincision glaucoma surgery with SALOPENSP shunt is a very effective modality for controlling and maintenance of IOP in patients with primary open angle glaucoma, and its greatest efficacy is in the range of 20 to 30 millimeters of mercury. No major complications were reported other than failure of filtration, and therefore we can say even the patients who had failure of filtrations were given anti-glaucoma medications, and then IOP was controlled in them. And so this procedure is very cost effective and is very safe as a newer modality of glaucoma implant surgery.
Did you see any evidence of hypotony in any of your cases? Because it's a non-valve shunt, directly connected.
Yes,
So
ma'am.
any evidence of hypotony was there?
Ma'am, no, ma'am.
How long was the follow-up period you mentioned?
Ma'am, 1 year follow-up.
1 year follow-up.
Yes, ma'am.
And any endothelial cell loss count was seen? It was not measured.
You've done it in all POAG cases, irrespective of how many drugs they were on, whether they were myopes or
yes,
thin sclera, nothing. You have not put anything in your exclusion criteria.
No, all primary angle glaucoma.
Even if on one drug.
One drug also, then 2 shunts, and multiple drugs also, then 2
Yes,
shunts.
ma'am.
Basically, you have to start with 2 shunts.
Yes, ma'am.
Just one query. The shunt doesn't have a hole. You have used a haptic, right?
So basically, the shunt, when you close the flap, it prevents the fibrosis of
Right.
the passage.
So it is just to prevent the fibrosis.
Yes,
It
sir.
does not behave like a tube shunt, right?
Yes, sir.
Okay.
It's just a spacer, sort of.
Yes, ma'am.
Creating a space.
Yes.
Okay. Thank you very much.